Hi everyone, my name is Victoria Daniel. Today, myself and my group members will be exploring occupational health and safety and why it's essential in every workplace. To do this presentation today with me is Abimbola Atoye and Alberta Nyako. Now, firstly, we'll be looking at what OHS means, its importance, then we'll discuss why OHS is a part of HR, that's the human resources management. Is not just a safety issue, it's actually people issue. We'll look at what employers and employee are expected to do to keep workplace safe. Next, we'll discuss how COVID-19 changed safety at workplace, including mental health concerns. And finally, we'll talk about workplace stress, and it could be harmful or helpful depending on how it is actually managed. Now moving ahead, let's begin by understanding what OHS really means. Now, like I said before, OHS is actually an acronym for Occupational Health and Safety, and it actually means creating. It's all about creating a safe, healthy, and supportive workplace. It includes rules, procedures, equipment designed to protect people from getting hurt and sick while they are on their job. Why is it then very important? When workers feel safe, they are more comfortable, they are confident. This leads to fewer accidents, less time off at work, and higher productivity. A safe workplace also shows that the company cares about their employees, which can boost morale and then loyalty as well. Now, you might wonder, why is OHS a concern for HR and not for the safety officers? The answer is not fetched. HR plays a central role in managing people, and keeping people safe is part of that job. HR is also responsible for creating safety policies, making sure that laws are followed, and training staff to avoid dangers at work. A typical example is under the Canada Labour Code that requires employers to take care of their employees' safety, and HR ensures that this happens. HR also tracks workplace injuries, ensures that there's safety meetings, builds a culture where safety is actually a top priority. Now, moving ahead, we're going to be talking about the employers and obligations in OHS. Employers have legal responsibilities to make sure that work is safe. This means giving employees safe equipment, clean spaces, and a clear safety procedures. They must provide training so workers know how to use tools safely and handle emergencies. A typical example is if someone is using heavy machinery, this individual should be trained to use it properly to prevent accidents. Employers must follow safety laws and standards like from Work Safe BC. If they fail to do this, they could face what we call penalty or lawsuits. Now, just like the employer has obligations in OHS, the employees also have their own obligations in OHS. Now, workers have responsibilities. They must follow safety rules set by their employers. For example, if the rule is to wear helmet in some certain area, this employee must make sure that he or she wears this helmet. Now, they need to use what we call the PPE, that's the personal protective equipment properly, like the gloves, the masks, the goggle. It's not enough to have a PPE, it must be used correctly to keep workers safe. Employees should also report any dangers or hazard they notice. For example, if they see a spill on the floor, they need to tell their supervisor to avoid slips, falls that can actually cause an accident. Moving forward, I'm going to hand over my colleague to continue. Thank you.
Thank you, Victoria. Hi, everyone. My name is Alberta Nyako, and I'll continue from where my colleague left. So, we are going to compare the key roles of employer and employee in ensuring occupational safety. Employees are primarily responsible for providing the necessary safety resources, such as PPEs and protective gears. They are also responsible for developing clear and safety policies to prevent accidents and injury. It is the employer's role to create and maintain a safety working environment for the employee and also themselves. Employees, on the other hand, are expected to follow these policies diligently. These include proper using of safety equipment, participating in training sessions, and also reporting in any hazard they encounter. It is important to note that workplace safety depends on both employer and employee working together. If either party neglects their responsibility, safety will be compromised. Now, let's move to COVID-19 and workplace safety. We all know that the COVID-19 pandemic brought new challenges for workplace safety. Many organizations had to implement several safety protocols like social distancing, frequent hand washing, and mandatory PPE such as face masks to minimize the risks of infection. Many employees transitioned to working remotely, which helped limit physical contact, but also brought new concerns like cybersecurity and also setting up a proper home office. COVID-19 also brought significant impact on employee mental health due to the stresses associated with the pandemic. These made organizations to expand their focus from just physical safety to include mental well-being as part of their health and safety strategies. Moving forward, let's talk about the employer and employee responses to COVID-19. With the employer, they had to adapt quickly to the changing public health guidelines, which include providing appropriate PPAs, updating safety policies, and also offering mental health resources such as counseling and support system. For employee, the pandemic brought many concern about their health, especially when they have to be on site. Others had to adapt to new ways of working, such as using Zoom and other digital platforms. Many employees also struggle to balance work responsibilities with caregiving at home, especially for most parents. Now, let's talk about occupational health and workplace stress. Work related stress could be a major occupational health hazard. It could have both positive and negative consequences. With the negative consequences, physically, it can lead to health problems such as heart disease, anxiety, and depression. It can also impact job satisfaction, whereby employees may have trouble concentrating or even completing tasks, which will reduce productivity. Workplace stress can also increase staff absenteeism, turnovers, and healthcare costs. So, while some stress are normal, too much can hurt both employee and the organization as a whole if not managed effectively. Thank you. I'll hand over my colleague to continue.
Thank you, Halberta. Hi, everyone. My name is Atoya Bimbola Oluwaseyi. Now, I will continue with the positive consequences of workplace stress. Occupational health and workplace stress emphasizes that some stress can be beneficial, and it highlights that stress, when managed well, can act as a motivator, which can foster innovation, focus, and growth. Instead of avoiding stress, we can learn to harness it to positive outcomes. And the benefits can be increased resilience, motivation, and skill development. Moving on, I'll talk about legal and financial impact of poor occupational health and safety. The first one is legal consequences. Failure to comply with occupational health and safety regulations can result in legal actions and penalties as enforced by the government of Canada. Secondly, financial cost. Workplace injuries and illnesses can lead to higher insurance and compensation claim, increasing overall business expenses. Now we'll talk about human resources strategies to improve occupational health and safety. The first one is comprehensive training to educate employees on safety protocols and hazard prevention. Secondly, promotion of safety first culture, where employees are encouraged on proactive safety measures and accountability. The third one is conducting regular workplace inspection to identify and address risk before they cause harm. The fourth one is establishment of safety communities, which engages employee in maintaining and improving workplace safety. The fifth one is providing necessary safety equipment like PPE, personal protective equipment. And the last one is implementation of reward system on, we'll talk about contrasting opinions on occupational health and safety responsibility. Firstly, we have the employer centric view, where employers should bear the primary responsibility for occupational health and safety. The second one is shared responsibility. While employers must establish safety protocols, employees also have a duty to adhere to this guidelines and report hazard. And the third one is debate on flexibility and enforcement. Some advocate for strict enforcement, while others suggest that flexibility can lead to a more engaged and responsible workforce. And finally, the summary of our key points on occupational health and safety. Firstly, we have the role of human resources, which is crucial in developing, implementing, and monitoring workplace safety policies. It ensures compliance with occupational health and safety regulation to maintain a safe environment. Secondly, we have impact of the pandemic on safety measures, which highlighted the need for adaptable safety strategies, including PPE, personal protective equipment, remote work arrangement, and mental health support for employees. And thirdly, we have understanding workplace stress. By recognizing both the positive and negative um, um, positive and negative effects of stress on employees and managing the well-being. Also, the last one is occupational health and safety as a shared responsibility. Both the employees and the employers play a vital role in maintaining workplace safety. Employer must set the guidelines and provide resources, and the employees must follow to letter the protocols and report hazards. Thank you. And here we have our references. Thank you.